I think this is the thing. If you only hear one thing from this podcast today, this is the thing to hear. You can't rely on therapy anymore, and you need to make sure your nurse's aides are entering Section GG. They don't need to do G and GG together. They just need to do the one. It's really not more work. It's just a new system and they have to get used to it. And part of the reason why Medicare switched to Section GG is because it's much more accurate. There is more inter-rater reliability, meaning that nurses' aides and therapists tend to score pretty consistently, as do RNs, and result in approximately the same scores, especially on the long-term care side. There's a little more diversity at admission for a skilled patient, but as we approach discharge of skilled patient and moving into long-term care, there's a lot more consistency between it. And what we see consistently as well is that nurses' aides tend to report an increased level of need for assistance, and that results in increased reimbursement. I mean, we want to get the appropriate reimbursement that we deserve based on the care we're providing. So if there's nothing else that you take away from this podcast, go make sure that your community has the nurses' aides documenting in Section GG. That's kind of the first and in many ways one of the easiest changes to make that could have the biggest potential impact, because you're going to impact nursing, PT, and OT reimbursement that way.